Human Service, Finance, and Policy Committee will come to order. We do have a quorum, and Representative Keeler moves approval of the minutes from March 11, 2025. Are there any additions, corrections, or changes to be made to the minutes? Seeing none, all those in favor of adoption of the minutes, please signify by saying aye. Aye. Opposed, say nay. The motion is approved, and the minutes from March 11, 2025 are adopted. First up today is Representative Noor, soon to be Chair Noor. Congratulations.
Mr. Chair, you're still the chair.
And Representative Noor moves that House File 1337 be laid over for possible inclusion. Representative Noor, to your bill.
Thank you, Mr. Chair. This bill addresses a significant challenge that we're facing in housing support, formerly known as GRH. Mr. Chair and members, this program provides housing for some individuals who are at the risk of institutional placement or experiencing long-term homelessness. This provides support to individuals who are elderly and disabled in different settings, whether you're in a CRS, ICS, assisted living, or other residential program that is coupled with the housing support. This program serves over 20,000 individuals. This is a focused program which spends over $200 million. Members, the average monthly payment for the housing support is $794. The challenge that we are faced with comes with the understanding that we have got 87 counties with 87 different processes in how to administer the program. Quite frankly, the bill for anybody who is eligible must have the basis for eligibility for general assistance or SSI. We've already set a task force to look into simplification of how we administer this program. However, with the challenge that we foresee, if you are in an assisted living, it's not guaranteed that you'll be getting housing support. If you're in a CRS program, that individual receives the housing support. The system is not balanced. The program needs a thorough evaluation to make sure that we meet the needs of Minnesotans. At the same time, we simplify so that those who are most vulnerable receive the service that they deserve. This bill, Mr. Chair and members, simply asks that individuals who are eligible in terms of the contract with the counties should not be denied simply basis of whether they're in 245D or assisted living or CRS. And the program is complicated by many factors, but I just wanted to make sure that we can hear from the experts who administer the program. I'll ask my testifiers to come forward and provide us more input on this program. Thank you, Mr. Chair and members.
Thank you, Representative Noor. Mr. Bergeron, welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair and members. My name is Matthew Bergeron with Larkin Hoffman, here today on behalf of the Residential Providers Association of Minnesota. The Residential Providers Association is a nonprofit trade association that represents small, customized living and waiver service providers. As Chair Noor just described, the housing support program is kind of an essential component of our service delivery mechanism, particularly for individuals with disabilities living in provider-controlled settings in the community. The program utilizes state funds, and the eligibility for it is tied to the eligibility of the resident, of the individual. However, that individual can only access those funds if they are residing at a setting that has a contract with the local county. These are state dollars, but it's county administered, and so in some instances, particularly in the metropolitan area, small providers have struggled to get access to that contract. Sometimes it's based just on sheer volume of settings in a county's workload. Sometimes it's based on rather than the newness of providers. A lot of small providers have come about in the last 10 years, last 15 years, and so that has had an impact on things. So while Medicaid waiver dollars that you all talk about in this committee a lot fund the cost of services, those dollars cannot be used to support the costs of room and board for these providers. And so even when a client is receiving services in a provider-controlled setting, and so one of the struggles there is the eligibility that makes someone eligible for these Medicaid benefits oftentimes also means they don't have the resources personally to pay for the room and board side of that setting. And so RPAM is seeking a legislative change today that would try to ensure providers can get contracts with those counties. Too often we've seen kind of broad mechanisms used for trying to administer the volume of applicants or the need here. And so there have been things like, well, we're not going to do customized living providers in this county, or we're not going to do settings that are using single-family homes. And we believe that there's way more nuance needed than that. And so the legislation that's brought forward today is something of a starting point to get at to that conversation. So I will point out that the governor's budget actually has a really interesting concept in it where settings that meet certain licensing or accreditation standards would be able to enroll directly with the Department of Human Services. These are state dollars, and so that way that, in that instance, the county wouldn't be burdened by the administrative side of those things. I think that's a really interesting opportunity and one that we hope to continue to talk about how it would apply on the disability services side, as well as the way the governor's office and DHS have presented it in behavioral health.
Thank you, Mr. Bergeron. Mr. Freeman? Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair, members of the committee. My name is Matt Freeman. I am the Human Services Policy Analyst for the Association of Minnesota Counties and the Executive Director for the Minnesota Association of County Social Service Administrators. Thanks for the opportunity to testify on this bill. The Housing Support Program is an important part of our continuum of care to keep people in housing. We've been in touch with the author and advocates about some of our concerns about this bill, and we're going to continue to work with them to improve housing supports. Counties continue to have concerns about not having administrative resources to carry out some of the functions required for them in housing supports. Representative Vernig is working with Dakota County on a bill to resource some of the administrative costs of housing supports for counties. Counties don't currently have, or all counties don't currently have, staff capacity for all the housing support agreements that would be a result of this bill, and we would have challenges staffing this work without new resources. And we need to be mindful of the county capacity to provide the required oversight and compliance work that goes along with these agreements. For housing support agreements, counties are required to provide oversight and quality assurances of providers. It's also not always in people's best interest or the best interest of those that we serve to have a housing support agreement with every individual or setting that is seeking an agreement. And so counties have concerns about some of the restrictions in this bill being placed on counties, requiring them to agree to these service agreements. Happy to take questions, and I know we also have an individual from Hennepin County here to speak more to the specifics about how they administer housing supports in Hennepin.
All right, thank you, Mr. Freeman. Is there anyone else who wishes to testify on House File 1337? Welcome to the committee. Please state your name for the record and present your testimony.
Good morning. Marcus Klemenko, Hennepin County. I'm an area manager in our housing stability area, which sits in our human services side of the shop, and have been working with the housing support program for about 30 years. Hennepin County has an approach to, it's a managed growth. It's an evolving program. I've seen it change greatly over the last 30 years. We work closely with providers as well as folks with lived experience to manage the types of housing support there is. As Representative Noor had mentioned, is there different flavors, and the different 87 counties manage it somewhat differently, although the oversight is still the same in some regards to what the responsibility is for the counties. At the end of the day, Hennepin County, in our approach and having an RFP process, a request for proposal process, is to look at what's in the best interest of the residents and the clients that we serve. Sometimes we have vacancies, an abundance of vacancies in a certain type of housing support. We want to make sure that we're managing that appropriately and working with our providers on that. The end of the day is also it's to ensure the quality and the service provisions that are in statute. And that is really that speaks most to that RFP process, that we do have a process in place to find out if the provider has the qualifications, if they have the experience, if they know the population. And that is what we do with our RFP. So annually, we invite providers to apply for a housing support agreement, which is a contract. We call them housing support agreements in Hennepin County. And we manage that growth. There are times that we say no to providers for a variety of reasons. There could be a setting that does not have access to transportation, or it's a provider that does not have experience working with that particular population. We ask them to work with a provider that does have that experience, and they can learn it from there. I'll take any questions.
All right. Mr. Klumeko, thank you for your testimony. Is there anyone else who wishes to testify on House File 1337? Seeing none, public testimony is closed. Questions for the bill author and the testifiers? Seeing none, final word, Representative Noor.
Thank you, Mr. Chair and members. As you've heard, there are different flavors and different challenges with the housing support. I think this is now the moment for us to look into a way that we can simplify the program and make sure that the program is aligned with the individual who's eligible rather than different process, because it's based on that eligibility. We don't want somebody just to simply be denied services because they don't have a contract, but we also understand that this is a state-funded program, and we don't have enough resources to go around. So we have to come up with a process, if not now, but in the next few years, we have to have a plan in how we address the challenges that we're faced with housing support. Thank you, Mr. Chair and members, for the opportunity to present this bill.
Thank you, Representative Noor, and House File 1337 is laid over. Next, Representative Backer. As he makes his way forward, Representative Backer moves that House File 973 be laid over for possible inclusion. Welcome, Representative Backer. Whenever you're ready, please present your bill.
Sure, thank you, Chair and members. House File 973, first of all 87 counties and 4 tribes are covered by mobile mental health crisis teams. These teams were developed to have a high mental crisis resources instead of calling police or EMS during their time of crisis, because obviously during the time of crisis, you want to make sure you get the right service instead of someone who has best intentions. And unfortunately, I've been on a few of those runs in which we have had mental crisis and have learned a lot of stuff. So that's why this is something that's important to me. While some services provided by crisis teams can be charged to medical assistance and Medicare, it is rare to provide for private insurance to cover the same services. The grant money provided by the legislative was to ensure access to services for all Minnesotans, which in 2023 was a one-time appropriation of $8 million. So what we need is the teams operating, and they did that so teams could operate 24/7 instead of, again, when there's in situation calling police, and sometimes they'll even call fire or EMS. And we need that readiness, just like we've been having the discussion in health about readiness for EMS. We need that readiness for mental health whenever help is needed, because if you have loved ones that need help, you want help now. Just like when we call fire, police, and ambulance. We don't want to, and at the same time, we don't want to charge the folks for calling for services because we want to help them during their time of crisis. Last year, we learned in a Fox 9 report that Ramsey County was charging people for using crisis services. And we don't want a financial incentive to have people in crisis to call police or fire. Additionally, as I said before, in 2023, we put roughly $8 million into this program. Now, what does this bill do? This bill does a few things. It allows crisis teams to make sure they do not charge individuals for services provided. It also refers to the standards laid out by medical assistants. So we have a standard that we go by, a more tighter standard. Delete provisions reference to a number, like in our area, and I had to use it once on an ambulance run it was a Friday night run at 1, called our Region 4, and that was not a 988 number. That was a couple years ago, 2 years ago. So what this does is it puts the crisis teams numbers and insert 988, so we're driving them to one strong resource. It states that co-payments, coinsurance, and deductibles do not apply to crisis service under Minnesota Care, and it provides an opportunity for funding of crisis services. In your bill, it's blanked, but it would be, I would ask that it be $4 million each year for a total of $8 million in a biennium. And this also allows to give people flexibility with those funds to help with a mobile vehicle and instead of transferring under an EMT. So with that, I have testifiers and one right now. One right now, not testifiers, just one.
Well, there's one that's remote.
There's going to be one remote, but one here. Okay, so go ahead, Sue.
Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair. Member Sue Abderholden, Executive Director of NAMI Minnesota, a statewide advocacy organization dedicated to improving the lives of children and adults with mental illnesses and their families. And Minnesota has been trying to build a statewide mental health crisis system for over 20 years. The goal is to create a mental health response to a mental health crisis. When we do that, we decrease interactions with police and decrease the possibility that someone will end up in jail instead of in our mental health system. It has been funded by grant dollars, along with teams being able to bill Medicaid and Minnesota Care. Once in a great while, private insurance will pay. As was mentioned, Fox 9 had reported that Ramsey County was charging people for crisis services. I will note that they did finally change that policy, but we want to make sure that this doesn't happen in the future. And I want to just say that it wasn't just a copay for insurance, this was the entire cost of the service, and people were not expecting that. You know, we've advocated for crisis services from the beginning, and it was never contemplated that someone would be charged for the full cost of this service. It really does set up a financial incentive for people to use police instead of crisis teams. I will say we've had, you know, many police departments that have been hiring social workers, and I want to just note that this is different than that. These crisis teams have standards that they have to follow statewide, and they have to follow HIPAA. You know, they have to report data to the state, so this is a different system than just a police department hiring someone. And I just wanted to make sure that that was clear. We really want these mobile teams to be viewed as fire and police first responders, and we don't have people pay for those out of their pocket. And I will say that 988 has really increased the connection with our mobile crisis teams, because people are learning about 988, they're calling 988 instead of 911, and of course then they're getting a more appropriate response. I will say that the funding for these teams is far below what they need in order to meet the needs. The total statewide funding for our crisis teams is less than the City of St. Paul or Duluth Police Department. So they simply cannot respond in the same timeframes, but they are still extremely effective and can address many issues over the phone. And in the handout, I provided information from the state about the number of calls that they took and what the disposition was. The 2023 bill did provide one-time funding, which means the teams are kind of facing a funding cliff. Some of that money was taken back last year because it was not spent. And I will say sometimes it's hard for our system to use one-time funds, because you don't want to hire people and then have to let them go 2 years later. And so, you know, really putting things in the base, I think in the future also makes a lot of sense. So again, this bill prevents teams from charging people, removes any co-payments from Minnesota Care for these services, and provides an opportunity for additional funding and for those funds to be used for something that we call protected transport services, which was developed several years ago as an alternative to someone being transported by police or by EMTs and ambulances. We only have about 3 vehicles in the state, and frankly, we need more because, especially in rural Minnesota, we want people to be transported with dignity, and we don't want to take those other vehicles, frankly, off of the streets in those communities. So thank you for the opportunity to testify.
Thank you, Ms. Abderholden. Next, through Zoom, we have Eric Sievers with the Hiawatha Valley Mental Health Center.
Good morning, Mr. Chair and members. I'm Eric Sievers, the Executive Director of Hiawatha Valley Mental Health Center. We are a community mental health center in southeastern Minnesota, serving 5 rural counties: Fillmore, Houston, Wabasha, Goodhue, and Winona. And I appreciate the opportunity to testify to support File 973. We're one of the many providers throughout the state. For over 10 years, we've been a provider of mobile crisis services in southeastern Minnesota. We are the only mobile mental health provider in this region, providing it 24/7. What we've seen over the last number of years is the numbers are growing with the implementation of 988 and with the additional state funding. What we saw in our area of the state is at the outset about 1,200 calls to the call center, which increased to around 9,000 last year. Our mobile response team in this year has seen a significant increase of assessments we've done. In the first 2 months of this year, we've more than equaled what we typically did in a quarter in the year prior. As the rate of suicide continues to rise, especially in rural Minnesota where we are, we know that this programming and our ability to meet the growing need works in part due to the various funding sources that are used to provide the service, including state grant funding. The state grant funding is doing exactly what it was intended to do for the community. It goes towards ensuring that we are able to have on-call mental health practitioners and professionals so that we can provide the best possible response time. Instead of using higher levels of care, which has been talked about, such as law enforcement, emergency room visits, we are able to provide more appropriate and better care with a mental health crisis team and focus on the crisis with the individual and their family to help manage that situation and stabilize them. This is not only providing those that live in Minnesota the best possible care, it's also the least costly form of care. So it is truly a win for all. What we can do with this bill is relieve the pressure on other parts of the system like law enforcement, jails, emergency departments. This funding removes barriers and helps support those without insurance or who have no insurance at all. Again, saving money for the state. The funding is not sustainable on billable services that we provide alone, which is why I ask that you please support stabilizing the funding for these critical cost-saving services provided in House File 973. Thank you, Representative Backer, for your work on this bill, and Mr. Chair and members for letting me testify today.
Thank you, Mr. Sievers, for your testimony. Is there anyone else who wishes to testify on House File 973? Seeing none, public testimony is closed. Questions for the bill author or his testifiers? Representative Keeler.
Thank you, Chair. I really appreciate this bill. I do know that a couple things, when you're in a mental health crisis, when you call 911, often, people show up with lights or sounds, which can really ignite a mental health crisis. And so I do think it's important that we have the right people respond. I think it's financially smart to do as well. I think it's crazy that we were charging people for this. And I guess I don't need to get into what Ramsey County was doing, but, any money that they recouped from charging people, were they able to give that money back to the individuals who were charged, or is that following them somewhere as a medical debt? Because I'm just thinking, like, unsheltered living, often medical debt starts the snowball to get individuals in trouble. Do you guys know where Ramsey County is at?
We do not.
Okay.
Representative Backer. Representative Keeler.
Thank you. So I appreciate that we're not going to do this at all in the state, because I think that's not humane. The one thing I do want to note that I really appreciate is not line 3.14 in the promotion of 988. nobody really loves to talk about suicide, and the fact that when we don't have these ongoing mental health services in the community, it increases the likelihood that somebody's going to end up in a one-time crisis, that they need help. And so 988 is something that we've been working a lot on promoting. One of the things we did in the K-12 system is student IDs now. In all of our schools, in the back of student IDs, the 988 number is there for our youth. We've been trying to get it in higher education. Can you tell me what your plan would be to promote this, or how we would promote this? Because we do want individuals to know that somebody's going to answer on the other line and be supportive.
Ms. Abderholden.
Thank you. Mr. Chair, Representative Keeler. 988, of course, is housed in the Department of Health, and so they have also been working to kind of raise awareness. We've even had actually, excuse me, some police departments on their police vehicles actually put 988 on there as a way to kind of remind people. We also have Travis's Law, which if someone does call 911, are supposed to refer someone. We loved being able to put it on the student IDs. We had done that voluntarily 2 years prior to that. Some districts, took us up on it, but not all. So I think if the crisis teams are making sure, there used to be a statewide number that wasn't 988 that didn't really work very well, but that's what's also mentioned in the statute, so we wanted to get rid of that and just focus on 988. I know that there are some additional things being done through the regional suicide kind of centers that are funded, but I will say there needs to be more, but it won't totally be covered here.
Representative Keeler.
Thank you, Chair. I work with Department of Health really actually deeply with 988, because I do think we need to build out a robust thing. If anybody else wants to get on that train with us, we need people to really invest in that area. So I guess what I'm hearing you say is that in this bill, when you say promote 988, it's really just leaning into what 988 is doing already. There's no unique promotion styles or things that you guys have determined that you will do to promote in your lane specifically?
Correct.
Mr.
Chairman,
Ms.
Representative
Abderholden.
Keeler, correct.
And also, if I can comment too, we're creatures of habit. If we start, everybody's focusing now, when we got started, many years ago, 911 was not for EMS. Now, everybody knows it's 911 for EMS, ambulance, fire, and police, so a creature of habit, that's going to happen. So when we centralize it, more people will use it when they need it.
Mm-hmm.
Representative Keeler.
Thank you. I think that this is an opportunity for members. We all have some sort of network within our community that people listen to us. And when we share out this information, suicide attempts is happening all over the state. It doesn't matter what community you're from. I think it's upon us sometimes to do this promotion part of what we have and what we're growing in the state. 988 is really wonderful. It has options to call if you're a veteran. It gives you those services, supports directly. And so I just really encourage all of us to utilize our own platforms to share in promoting what we're doing here with 988, just so our communities can be safe, and that our kids and our families know that we're creating nets to help them in the most crisis situation. Thank you.
Thank you, Representative Keeler. Representative Gander.
Thank you, Mr. Chair, and thanks for your testimony. Couple of questions. I'm learning about 988 on the fly right here, I have to confess. So this would be for suicide and also for other kinds of crises, is that right?
Yeah,
Representative Backer.
mental.
Yeah, mental crisis.
Yep,
So
that is correct.
If I'm
Because we want to make,
Yeah, yeah. Thank you, Mr. Chair.
Representative Gander.
So
go Representative.
if I'm schizophrenic and I sense that I'm in a bad place, some kind of an acute event, I dial that number and I can get some help.
Representative Backer. Ms. Abderholden.
Yes.
Yes.
Representative Backer.
It's EMS, it's emergency help, and not just emergency, but it's obviously suicide, mental health crisis, and so forth. Just like we have medical crisis and we call 911 for that, or other type of, with fire, this is for mental health crisis. And we're working on giving those tools to help people who are thinking about suicide or other type of having a mental crisis.
Representative Gander.
Thank you, Mr. Chair. We're getting there. We're doing better now. So if I call this 988, and is there someone on that end that can triage that? And if I'm really in also another kind of medical emergency or need 911 services, are they linked to, say, my local dispatch to triage my call and dispatch, say, EMS or other first responders through the 988?
Representative
go
Beck.
ahead. You can
Ms. Abderholden.
Mr. Chairman, Representative, yes, so 988 is connected not only because we have call centers throughout the state, they can connect with the local police, fire, whatever that is they need. I will say, though, that the percentage is extremely low that they need to actually refer out. Even for some of the crisis teams, it's low because they really are able to engage with someone, help them kind of walk through what they're struggling with, and really resolve a lot of it, frankly, over the phone. It is pretty amazing what they can do.
And I would like to,
Representative Backer.
yeah, thank you, Chair. And a lot of times it's just somebody to listen. And I don't use the word just as meaning it's minimum. Some of those simple things can do a whole lot, and that's really what it's doing, especially when someone's thinking about taking their lives.
Representative Gander.
Thank you, Mr. Chair. One last thought or question. Let's say we are in that emergency where there's a medical emergency and a mental health emergency. Do you find that you have good coordination on site, right? Do these teams coordinate pretty well together, or is that something else that we need to improve? Thank you.
I'll take,
Representative Backer.
I'll take that. From a practical perspective, with the times that I've been on scenes, everybody involved wants to help that patient. So yes, we do work well together, okay? Are we perfect? No, of course not. But our full intention is to help that. Generally speaking, if it's a medical emergency and requires airway, breathing, or circulation, we got to take care of those problems first because those are life-threatening. I'm not saying that the mental's not life-threatening, but those are immediate where then we can address that. So I've been on a scene for an hour and a half on a mental crisis. I've been on many of them, but this one in particular, an hour and a half. Myself, police, talking them down. We had a child involved, pets. It was quite a difficult situation, but we were able to solve that situation, and that was actually before this, that we had that. This would have been very helpful to have something like that. What we ended up doing was we separated the two parties. One went with the mom, grandma, and the other one stayed home, and that's how we solved that crisis. But it would have been very much helpful to, because that was not an emergency, a medical help, it was a mental, it would have been nice to tap into it. And this gives us those resources, because this happened before 2023.
Representative Gander.
Thank you, Mr. Chair. That's all I have. Thanks.
Representative Curran.
Thank you, Chair. And thank you, Representative Backer, for the bill and just for the recognition of how important it is to serve people who are in a mental health crisis. I really appreciate that we're highlighting 988 and those services today. Just want to jump on the team of saying 988 again in the microphone so people hear it. I do just want to address, there was the news story that you had mentioned out of Ramsey County. And I know that in that case, it was an uninsured resident who needed to access the service. And from what I hear from Ramsey County afterward, they had community input and implemented a policy similar to what your bill is doing, saying that grant funds would be used for uninsured or underinsured folks, right? And I agree, like, nobody should have to pay out of pocket for anything like this. But, we also, in the context of human services spending and all of the things that entails, we have a lot of discussions about where the burden of those costs do lie. Because even though these services are really important, at the end of the day, they do cost money, right? And that's why we're here with this bill. And so I just want to make sure, too, that we're being mindful that even when counties are accessing grants to cover these expenses, they might only be getting 23 or 25% of those expenses covered. And so then that falls back on the county. And I'm not suggesting that we then pass that back on to residents who are using the service, but we all know that when a county continues to incur expenses without a revenue stream, that will end up upon all of the residents of the county at some point, right? And so I just wanted to sort of have that as part of this conversation, that I don't think any of us want to be personally charging people who are accessing this service, but we should be looking at how we're supporting counties so that these services are fully funded. so that then we're not just passing the buck on, because we really want to make sure folks are accessing this and not to a high expense. So just wanted to say that. I do think this is a great idea. I don't think anyone should be paying for it, so I think it's a step in the right direction. I appreciate it.
Thank you, Representative Curran. Any response to that in particular, Representative Backer?
Yeah, I'm, in this bill, yes, thank you, Chair. In this bill, we do have, I know it's ... but talk to nonpartisan staff, it would be 4 million, 4 million. So our goal is not to pass the cost to the county and so forth, because this will save, this, number one, most important is to help the person in need. Okay, at the same time, it will also save money, okay? Because when you dial 911, that's the most expensive care, and you're not getting the best of care, okay? We had a run many years ago that the person thought, she thought she was George Washington. And that's not to be humorous about it. We just, I think 3-4 years on the service, we just didn't know how to handle it, okay? So we ended up doing a transfer, which round trip was 150 miles, extremely expensive, okay? So this will actually serve money. And then as we've heard, and I've also heard firsthand, that people get the help, we walk them off the ledge, okay? Because a crisis is a person's on a ledge, let's face it. They're on some type of a ledge, and they need someone to help them, so thank you.
Ms. Abderholden.
Thank you, Mr. Chair, Representative. I think the one thing to remember is that we are trying to create a statewide system, so people know if I call 988 and I get a crisis team, this is exactly what will happen. And I understand there could be additional costs perhaps to the county, when state funds and grants don't cover everything. But we need to make sure that people know we know what happens when you call 911, right, in terms of you have a fire. We need to make sure that when people call 988, they know exactly what will happen and that they will not be charged.
Any follow-up, Representative Curran? Representative Noor.
Thank you, Mr. Chair. Thank you, Chair Becker, for bringing this bill forward, and Ms. Abderholden for really advocating for this, because mental health system was never built. So we're building on the fly as we go. Just quick question about the section for the grants. I don't know if Mr. Berg will be able to help us. What is the current funding for mobile crisis grant program?
Mr. Berg.
Mr. Chair, Representative Noor, my colleague, Mr. Harney, fed me a little data on this. I'm not sure about the base appropriation, but there is currently, it was 19 million was the appropriation in the current biennium.
Representative Noor.
Thank you. But also, I wanted to also separate the equipments and the vehicle, protected transportation, because I think sometimes we may get mixed up between the two, between the program and the need for having protected transport as the bill has been drafted. So hopefully we can work together to really separate the two. Having the transport is really key especially for smaller counties who cannot afford to have those vehicles. So hopefully we can work together and address it.
Thank you, Representative Noor. Representative Backer.
I have no comment on that. I would agree.
All right. Seeing no further questions from members, final word, Representative Backer.
Yeah, thank you. Ask for your support there, Chair, as we continue down the line.
All right. With that, House File 973 is laid over.
Thank you so much.
Next, Representative Curran. As they make their way forward, Representative Curran moves that House File 381 be laid over. Please state your name for the record and present your bill.
Thank you, Chair. Yes, so House File 381 first, I think if we want to move the A1.
Yes, Representative Curran moves the A1 amendment. And that's the author's amendment. Are there any questions for the amendment? Seeing none, all those in favor of the A1 amendment signify by saying aye. Aye. Opposed, say nay. The A1 amendment is adopted. Representative Curran.
Wonderful. Thank you so much. And just a quick review, the amendment deleted some language that would impose a penalty, and we are looking to eliminate some costs in this bill, and the amendment would help do that. Chair and members, in front of us today is House File 381. This is brought forward by ARM, and this bill contains policy proposals that address current challenges identified by disability waiver service providers. All are intended to have no cost to the state. 5 key provisions in this bill are allowing providers to negotiate with their lead agency for a housing support rate add-on for individuals who cannot live with others. The others requesting a waiver amendment from CMS to allow property damage to be reimbursed using existing dollars in environmental accessibility, in the Environmental Accessibility Adaptation Fund. Third, establish a 30 business day timeline for lead agencies to process service authorizations. The fourth is requiring the Department of Human Services to engage in stakeholder collaboration on the process and forms providers are using when requesting rate exceptions. And finally, allowing a rate exception to stay in place if the individual's case manager and the support team determine that removing that rate exception would harm the individual's well-being. These slate of proposals are critical to service providers in their ability to be responsive to the needs of individuals they're supporting. With me to explain each proposal in greater detail is Sarah Grafstrom with ARM.
Welcome to the committee. Please state your name for the record and present your testimony.
Thank you. Good morning, Mr. Chair and committee members. For the record, my name is Sarah Grafstrom. I'm the Senior Director of State and Federal Policy at ARM. And thank you for the opportunity to present ARM's policy bill consisting of 5 provisions aimed at improving the processes of establishing payment rates and rate exceptions, as well as providing needed resources to providers and individuals with higher support needs. Beginning with Section 1 of the bill, we're proposing to establish a 30 business day timeline for lead agencies to review and process service authorizations. Providers are seeing increased timelines for the approval of service authorizations, with some providers reporting 6 to 8 months past the renewal date before they're able to get a service authorization returned. This creates serious cash flow problems for providers as they are not able to bill for services without that service authorization in place. Section 2 of the bill would allow an approved rate exception to stay in place for an individual if the support team determines that the rate exception is necessary for the individual to maintain their well-being. Rate exceptions are based on the exceptional need of the individual that the DWRS framework rate does not cover. And current practice is that if the exceptional need goes away, the rate exception would no longer be appropriate to keep in place. However, we would argue that for some individuals, the exceptional need does not go away. Rather, the services put in place to address the exceptional need have been successful in reducing behaviors or incidents associated with that need. The reduction doesn't mean that the need doesn't still exist. It just means that the resources currently utilized to address it are effective and shouldn't be removed because of their effectiveness. Our proposal would allow the rate exception to remain in place if at the time of the annual review, the individual support team determined that the exception is important for the individual's continued well-being. Section 3 of the bill would require stakeholder consultation to periodically review, revise, and update the format by which rate exception requests are collected and reviewed by lead agencies. Allowing stakeholder consultation in revising processes and procedures for rate exceptions promotes a collaborative, responsive, and transparent approach. This language will help to ensure that the voices of those directly affected by the rate exception process are at the table, sharing real-world challenges, emerging trends and needs, and leading to a more responsive system that better supports people with disabilities. Section 4 of the bill provides the ability for providers and lead agencies to negotiate a monthly housing support room and board rate add-on not to exceed $1,000 a month for individuals who reside in a licensed community residential setting and who cannot live with others or would be more successful living in a home without roommates. The current housing support rate is $1,170 a month. These dollars are supposed to cover rent, utilities, food, maintenance, housekeeping, and home furnishing. When an individual is living with roommates, these dollars are stretched to cover all the costs. But when someone is living in a home by themselves, they come nowhere near covering the cost of room and board. This gap in funding is leaving many individuals in settings that are not appropriate or do not meet their needs, including emergency rooms or homes where they are not getting the appropriate level of support. Finally, Section 5 of the bill would direct the Commissioner of Human Services to seek a waiver from CMS to allow environmental accessibility adaptation, or EAA, dollars to be used to cover the cost of property damage caused by an individual receiving services under the waiver. Outside of maintenance costs that are included in an individual's housing support rate, the cost of property damage is not reimbursed to the provider. This results in individuals who have a repeated history of property damage being unable to find providers willing to provide services to them. Individuals on a waiver are eligible for up to $40,000 annually in EAA dollars to cover home modification assessments and installations and vehicle assessments and installations. We are proposing adding property damage to the allowable use of these dollars. With that, Mr. Chair, thank you for the opportunity to testify, and I'm happy to answer questions.
Thank you, Ms. Graston, for your testimony. Is there anyone else who wishes to testify on House File 381? Seeing no one, the public testimony is closed. Questions for the bill author? Representative Noor.
Thank you, Mr. Chair. Thank you, Representative Curran, for bringing this bill forward. But then the question that I have is, I think this goes opposite of what the governor's recommendation on rate exceptions. Do you know the increases that we've seen over time when it comes to the rate exceptions, particularly when the lead agencies are in charge of making those exceptions with the support of the state?
Representative Curran.
Thank you, Chair. Thank you, Representative Noor. First, that's absolutely correct. And I'd like to say that on the record that that does go directly against what is proposed in the governor's budget. And that is because, as Ms. Grafstrom said, when folks are being approved for an exception, it's because they have a need that is greater than what we are resourcing for them. I've seen this happen in practice where somebody is losing mobility because they're not able to get up, get out of the house, especially with workforce shortages, where we've had to add a rate exception so that, excuse me, a physical therapist or someone could come and visit them every day and get them up and get them moving. And we can't just, call that temporary. That person needs that service to continue in order to, regain their mobility and, improve their health. And if we were to remove that physical therapist, that person would regress to where they were before, right? And so just on principle, I think the idea of not allowing those rate exceptions to continue just doesn't address the whole person and how these rate exceptions actually impact their life. I will say too, and I'll turn it over to Ms. Grafstrom in a second here, but it's my understanding too that when somebody's approved for a rate exception, that isn't budgeted on a temporary basis. That just goes in as, okay, this is the person's rate, and now this is the exception that goes on top of it, and that's included in the budget. So there isn't this sort of window in the future where we expect those dollars to come back. It's already put into the budget. And so it sort of doesn't make sense either to say that we should reduce the exceptions because budget-wise, once they're in, they're in. And I'll turn it over to Ms. Grafstrom.
Ms. Grafstrom.
Yeah, thank you, Chair Schomaker and Chair Noor. I agree that what we're seeing with rate exceptions, we are seeing a growing trend in the use of rate exceptions. However, we would argue that that trend is not due to the fact of improper use of rate exceptions, rather that payment rates have not kept up with the actual need to provide services. And so we are looking at that rate exception as a way to meet the needs of people with those exceptional needs.
Representative Noor.
Thank you, Mr. Chair. I think based on the facts that we've been provided, the rate exceptions were about 4%. That was the projection, and it's going up to close to 29%, if I'm correct. And I just wanted to check, I don't want to put you on the spot, Mr. Berg. I don't know how much was the total cost savings banked by the governor in terms of addressing rate exception, or maybe someone from the agency. Anyone with the numbers? I don't know if Peter wanted
Doesn't
to
look
come.
like it.
Yeah, I think Peter has got some numbers. Ask them to text quickly, phone a friend.
Welcome to the committee. Please state your name for the record and help us with Representative Noor's question.
Good morning, Peter Butler with the Department of Human Services. Mr. Chair, Representative Noor, to your question about rate exceptions, it's approximately about 20% of the population. And I can get that number about what it's in the governor's budget. I just need to pull it up real quick. Sorry, it might just take me, but my computer doesn't work great in this room, I'll be honest. Mr. Chair, Representative Noor, so in the governor's budget right now for the rate exceptions, the savings for fiscal year 26-27 would be projected at about $50 million. And then for the fiscal 28-29 biennium, would be approximately $81 million. And those numbers will get updated with the February forecast. So this is as of the November forecast.
Representative Noor.
Thank you, Mr. Chair. And I think with the February focus, we have seen an increase, including DD and CADI waiver programs. So that increases to a couple of $1 million that are being banked, making sure that we address the issue of rate exceptions. So I think we need to have a deep dive and figure out how we are able to adjust where we should be. So hopefully we can have that conversation. Thank you, Mr. Chair.
Thank you, Representative Noor. Representative Murphy.
Thank you, Mr. Chair. Thank you. My question has to do with a little bit with the 40,000 per eligible for damages. Can you explain what the process looks like as far as a provider, trying to, get funds because of that damage, what that process looks like?
Representative Curran.
Thank you, Chair. Thank you for the question. And again, I'll turn it over to Ms. Grafstrom in a second. But first, just to sort of give folks an idea of what this looks like in practice, where we might have somebody with some high needs and someone who might, for example, frequently put their fist through a wall, somebody who doesn't maybe have other ways to communicate other than through, putting their fist through a wall, right? And that's the kind of property damage stuff that we're talking about. And so in my experience, working for a provider, that could be something that in one home where we've got folks that engage in that behavior frequently, maintenance staff are there very frequently, patching holes, trying to come up with, maybe if we put up a wood paneling, they won't be able to punch through that, or they won't try to. And so we're talking about the costs incurred for maintenance staff to be there, the materials, and of course the frequency with which that might happen. And for a lot of providers who, many of whom are nonprofit, tend to just pay for that out of their funds. And we know that the reimbursement rates in the first place aren't meeting it, our workforce needs in the first place. And so they're certainly not meeting any sort of needs that pertain to property damage. So then what happens is when nonprofits are doing their fundraising and trying to get more money to send people on the trip of a lifetime that they've been dreaming about, or get adaptive equipment that they don't have the current access to, then those donated funds end up being used to cover some of these everyday, not great experiential sort of things that we could be providing for folks. But I'll turn it over to Ms. Grafstrom for more.
Ms. Grafstrom.
Yeah, thank you, Chair. Thank you, Representative Murphy, for the question. I asked the same question of our members. What role does insurance play? How are you covering these costs now? So the insurance piece, many of our members shared that the deductible would be too high to make individual claims on property damage. And then there's always the concern that your rates will increase because of, you're making too many claims or you'll get dropped from your insurance coverage to begin with. So I think the insurance avenue has been a challenge for folks to go down. So what do they do then? Representative Curran shared lots of our members will fundraise to cover some of the costs. One of our members shared that they absorb about $15,000 to $20,000 annually in property damage, just based on kind of the individuals that they're serving and some of the damage that's caused. They might defer, maintenance or updating to the home to be able to cover other property damage. If a TV is broken, they might not be able to replace it, which is unfair for the other roommates that are living there because one of their roommates broke a TV. So I think that it really depends on the individual home and the situation, and how the provider can absorb those costs because they aren't reimbursed now.
Representative Murphy.
Thank you, Mr. Chair. And I can understand the need. I guess what my question was, I'm trying to understand what the process looks like. Do they take pictures? Do they send it in? Is there an appraiser that comes out? Is there an auditor? How do we follow up with our money to make sure that it's being spent on what it's supposed to be spent on? And so it's more the process I was looking for.
Ms. Grafstrom.
Yeah, thank you, Chair Schumacher, and thank you, Representative Murphy. As far as the process, I think that will have to be established through the use of these funds. Because we don't have any way to be reimbursed right now, there is no process in place. And so I think it would be very similar to how we are able to access the EAA dollars now by working with the state on the need and following the processes they have right now. So if you have a need for an adaptation in your home, you work with the state and follow the processes that they have in place right now to get that adaptation. The property damage would probably follow a similar process that's in place.
Representative
Thank you,
Murphy.
Mr. Chair. Just one follow-up question, maybe for Mr. Butler. For Section 5, what is the estimate for the overall cost of Section 5 then? How much money will we allocate for that?
Mr. Butler.
Mr. Chair, Representative, we're still evaluating that for the fiscal note, but we do have a request and we are working on it.
Thank you, Mr. Chair.
Thank you, Representative Murphy. Seeing no other questions, Representative Curran, final word.
Thank you, Chair. Thank you, members. I appreciate your consideration as we move through session. I just want to give shout outs to members of the committee who have already signed on to the bill. Thank you to Representative Gander, Chair Schumacher, Chair Noor, Representatives Norris and Vernig. There is still room to sign on, and thank you for your time.
Thank you, Representative Curran. House File 381, as amended, is laid over. Next, Representative Curran moves House File 382 be laid over for possible inclusion. When you're ready, Representative, present your bill.
Thank you, Chair. Yes, before us today, we have House File 382. So this is for folks in the industry, otherwise known as the Best Life Alliance bill. Chair and members, the problem and solution behind the bill before you today are fairly straightforward. For our constituents with significant disabilities, we all desire for them to have better access to the disability services that support them to live full and connected lives. But for our constituents to have better access to these services, we have to continue to address disability staffing shortages, services staffing shortages. And to address the staffing shortage, we have to work toward medical assistance reimbursement rates that cover the cost of competitive wages and benefits for these staff positions. The bill before us today contains two targeted and data-driven reforms to our state's waiver-funded disability services reimbursement system. The first change in the bill updates the competitive workforce factor to reflect the most recent data analysis from DHS. The second change in the bill updates the standard occupational codes used to set supervisor wage factors. Again, these changes are aimed at making direct support and supervisor staff wages more competitive to help address the workforce shortage. And I would like to thank so far authors who have shown support, Chair Schumacher, Chair Noor, Representatives Gander, Norris, Vernig, and Hicks. And I will now turn it over to my testifiers.
Thank you, Representative Curran. And before we do that, do you have the A1 amendment that you'd like to offer?
I sure do. I would like to move the A1. That's a technical amendment.
All right, the A1 amendment is before us. Are there any questions? Seeing none, all those in favor of adoption of the A1 amendment signify by saying aye. Aye. Opposed, say nay. The A1 amendment is adopted. To the testifiers, welcome to the committee. Please state your name for the record and present your testimony.
Good morning, Mr. Chair and members of the committee. My name is Julie Johnson, and I'm the president of MSS, an organization that provides employment and day supports to people with disabilities. I'm also the Government Affairs Chair of MORE, the statewide association of 100 nonprofit organizations that also provide employment and day supports to Minnesotans with disabilities. Thank you for the opportunity to speak before you today in support of this legislation, File 382. At MSS, we see examples every day of the positive impact waiver-funded disability services have on the people we serve. A young man we support was recently assisted in securing a job working at the Minnesota Science Museum, and this job has increased his independence, confidence, and community connections. This opportunity has sparked his interest in going back to school to further his education. However, on the flip side of each success story, there are hard conversations that my organization has every day with about 150 people on our wait list for services, whom we are not able to serve because of our staff vacancies. Many of these individuals have been on our wait list since they graduated from high school 2 years ago. Without access to services, individuals slowly lose those skills that they work to develop in school for the transition from youth to adult life. Some people are at home, requiring a family member to scale back their work in order to provide the support that they need during the day. This is why my organization and so many others are supporting this bill, which contains changes to the competitive workforce factor as well as the supervisor wage factor within our disability waiver rate system aimed at addressing this workforce shortage. I want to acknowledge the significant investment that the legislature has made over the last decade to support waiver-funded disability services. Those investments have been critical for us to address the statewide lack of access to services. However, due to the decades of underinvestment in community-based disability services, even with these investments, some real disparities exist between the reimbursement rates and the cost of providing these services, particularly around staffing. This gap in reimbursement negatively impacts the ability of organizations like mine to attract and retain skilled staff, which in turn makes it harder for people across Minnesota with significant disabilities to access the supports they need to gain new skills and increase their independence. We know that legislators will have to grapple with some very challenging questions this session about how to meet the critical needs of our state within the confines of the revenue available. We are asking you to see our community members, friends and family members with disabilities as a priority in this work. Please partner with us as you've done in the past to move our state forward, certainly not backwards, as the governor's proposed cuts would do, in providing wages and benefits that allow us to hire the staff needed to support Minnesotans with disabilities to live full, meaningful lives. Thank you, and I'm happy to answer any questions you may have.
Thank you, Ms. Johnson, for your testimony. Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair and committee members. For the record, my name is Ken Bentz. I'm the Director of Research Analysis and Policy for ARM. We're presenting this bill on behalf of the Best Life Alliance. As you all know, our sector has been chronically underfunded for many years and even decades. And while there were very meaningful investments added in the 2023 session, we know that more needs to be done. So today we are asking for more steps forward in the ongoing investment it takes to support a growing population with increasingly complex and intensive needs. As we've said year after year, and as Representative Curran said in her introduction, the most impactful way to target investment is to lift up a struggling workforce. You all know about the workforce crisis and how the pandemic made the issue so much worse. The two provisions of this bill that are directed at strengthening the workforce are data-driven, thoughtfully constructed, and I'll take you in sort of a narrow shallow dive into some of the technical aspects. The competitive workforce factor, which was first introduced in the 2019 legislative session, was a great concept as a way to close the gap between the wage factor for direct support workers and disability waivers and people working in other occupations with similar training and experience requirements. It was first set at 4.7% and was increased to 6.7% in the 2023 session. However, the most recent analysis by DHS submitted to the legislature in 2023 shows a gap of 16.76%. So our bill would increase the factor by approximately 10 percentage points, and fully adjust the wages by that 16.76%, and that's reflected in sections 2 through 9 of the bill. How can we expect service providers to pay competitive wages when the rate frameworks reimburse them at a discount of nearly 10%? And the second provision, which is in section 1 of the bill, would correct a situation that was partly a result of the competitive workforce factor. The factor only applies to the direct support wage component of the rate system and not to the wage for supervisors. In the last 5 years, as the median wages of occupations that are used to calculate the wages have increased, and the adjustment in the competitive workforce factor has also increased, there are now instances in the frameworks where the direct support wage figure is actually higher than the supervisory wage, and that's not a realistic scenario for any employer. So our proposal would make a single change to the occupational codes used to derive the supervisory wage. Currently in the rate system, the supervisory wage is equal to the median wage for the job known as Community and Social Services Specialist. Our proposal would modify that wage by calculating a new supervisory wage, which is made up of 40% of that Community and Social Services Specialist, and then 60% of the Community and Social Services Manager wage, which also more accurately represents the differentiation of job duties between workers and their supervisors. So those are basically the technical aspects of the bill. Thank you for letting us present today, and I'm happy to answer any questions.
Thank you, Mr. Benz. Is there anyone else who wishes to testify on House File 382? Seeing none, public testimony is closed. Questions for the bill author? Representative Noor.
Thank you, Mr. Chair. If you can really understand how DWRS calculation is done, you have received a PhD. It's complicated. And looking at the supervisory staff, you said 60% from the community service manager and 40% from the community service specialist. What are the key difference between the two when you calculate on the average?
Mr. Benz.
Thank you, Mr. Chair. Representative Noor. As the titles suggest, one is a specialist, which is more focused on the delivery of services, and the second one is a manager, which has that aspect, plus the more supervisory and management responsibilities. And as I said, so that would more accurately reflect what a supervisor actually does in a residential setting and a group home kind of a situation.
Representative Noor.
Thank you, Mr. Chair. So I was just thinking about the average payment, between the difference between the two, so we can just see in the long term how much that calculations will look like.
Mr. Benz.
Thank you, Mr. Chair. It would increase, I believe the current wage is in the $22 an hour range. This calculation would increase the hourly wage to about $30 per hour for the supervisor.
Representative Noor.
Thank you, Mr. Chair. I was just trying to make some quick calculations, see what the difference will be. Thank you.
Thank you, Representative Noor. Any other questions for the bill author or the testifiers? Seeing none, final word, Representative Curran.
Thank you again, Chair, and thank you, members who've already signed on. Again, there's plenty of room for the rest of the committee to sign on to this bill as well. And just, I'll say from personal experience from working for a provider that we're talking about today for 20 years, in my experience, I've seen folks come into this field and stick around for a long time. 20 plus years in the capacity oftentimes of a direct support professional. And one of the reasons that we see that happen is because of the wage disparities between, folks who are directly on the floor and folks who are in a supervisory capacity. But what happens is we get those folks who are so dedicated and passionate about the care that they provide, and they're stuck. They're not able to move forward in a viable career path in this industry that we have. And so that has sort of brought us to where we are today, is that we still don't have a very robust or viable career path in this industry. Oftentimes folks are sort of stuck at that entry-level position, even though they gain the skills to become a supervisor at some point. And there's really not much incentive then to have more responsibility, more engagement with, county and state agencies in your role in managing staff and sort of all of that stuff. What happens is somebody becomes a supervisor, there's still a staffing shortage, they end up doing all of the direct support care hours, and they're essentially a direct support staff, and could be making less than than the staff they supervise. So that's where things are at. This is part of the solution of a long-term trajectory in showing our priorities and making this a solid career for folks. So I thank you all for the consideration and support.
Thank you. And with that, House File 382 as amended is laid over. Finally for today, House File 1831, Representative Zeleznikar. As she makes her way forward, I will move that House File 1831 be laid over for possible inclusion. And there is an A1 amendment that I will move as soon as we are ready to go. Representative Zeleznikar, welcome to the committee. I will move the A1 amendment. Any questions to the A1 author's amendment? Seeing none, all those in favor of adoption of the A1 amendment signify by saying aye. Aye. Opposed, say nay. The A1 amendment is adopted. Representative Zeleznikar, to-year bill as amended.
Thank you, Chair Schumacher and members. This is really a bill that makes things better. It has bipartisan support, and this allows another pathway for criminal background checks with the A1 amendment. And this is something that I've worked with members on both sides of the aisle for the last 3 years to try to make systems and processes work better so we can serve the people that we're intending to serve with the money that we allocate. And in this situation, this is to help us serve homeless people and in situations like that. And so barriers are not necessary. And so this is a really great bill. It's one I've been challenged to find solutions for 24-hour operations, nursing homes, assisted livings, disability group homes, because there are many times when people are, we've had issues with multiple things. And this is something I'm working with DHS with, for members to know, and for us to have a platform that will work. And so, Chair, I'd like to defer to the testifiers to talk about this bill more.
All right, who would like to go first?
I can
You're
go.
welcome to the committee. Please state your name for the record and present your testimony.
Good morning, Mr. Chair and members of the committee. My name is Christina Jacobson, and I'm the Director of Equity and Human Resources at Simpson Housing Services, where we provide housing support and programs and a 24-hour emergency shelter. I'm here to speak about why I am in support of House Bill 1831, which would no longer require our staff to submit to DHS background checks with fingerprinting, and instead allow us to use other vendors which are less expensive, more efficient, and transparent. At Simpson, it takes over 50 hours of staff time to hire one person, and that is per applicant, including all the interviewing, reference checks, paperwork, and other processes. So when we find a great candidate and we lose them because of delays in DHS processing time, it's devastating, not only to all the staff time and resources that were wasted, but also the supervisor and the team who are invested in making this person a member of their department. DHS background checks can take a really long time to clear. Sometimes it's days, but often it can be weeks or sometimes over a month. Employees can't wait that long for a determination that could drag out, and so they often look elsewhere, or in some cases, we have to move on and hire someone else to fill our program needs. DHS background checks are not only inefficient and a time burden, but it also burdens the employee who has to find a location to get fingerprinted, make an appointment, take time off to pay the fee. Sometimes our staff live in areas that there aren't any nearby testing sites, and many do not drive cars, which makes the process even more burdensome. Overall, the background checks are duplicative, expensive, but they most of all, they hinder our ability to hire staff quickly to meet our program needs. Thank you.
Thank you. Welcome to the committee. Please state your name for the record and present your testimony.
Good morning, Mr. Chair. Good morning, committee members. I'm Marcus Schmidt, Executive Director at Hearth Connection. What Christina said. At Hearth Connection, we focus on supportive housing. We work with 35 service providers across the state to provide them with resources, training. We convene. We perform some advocacy work here at the Capitol to make sure that we're simplifying these systems, these resources that they rely on to serve individuals with long histories of homelessness. For us, supportive housing is both a noun and a verb. You need the affordable, safe place to live, and you also need the support to help people maintain that safe place to live and get the resources that they need and services they need to thrive. Our partners, like Simpson, also need the ability to hire folks to do the hard work. That's why I'm here today, to express my enthusiastic support for House File 1831. Emergency shelters and supportive housing providers, as many of you know, have been operating through a workforce crisis since the pandemic. That crisis persists. The DHS background study requirement for staff, board members, volunteers is getting in the way of hiring, like Christina was saying at Simpson. We need our fellow Minnesotans to do this hard work right now. And this proposal allows existing alternative background check methods to be used in supportive housing and emergency shelter settings that are receiving funding through the state's housing support program. Some alternative methods include the BCA, private companies, local law enforcement. These alternatives are cheaper, they're faster, and they're just as effective. And to be clear, this proposal will improve safety, not compromise it. The legislative alternatives, the legitimate alternatives I just mentioned, BCA, private companies, local law enforcement, they make sure that there's due diligence. And this proposal will also make sure that organizations have the staff needed to meet their ongoing safety and security concerns. Right now, Minnesota's supportive housing infrastructure is fragile, and this background study bureaucracy will only lead to more unfilled job vacancies and more unhoused Minnesotans. It's also common sense, and it's got the support universally of multiple coalitions, including Homes for All, the Minnesota Supportive Housing Coalition, the Minnesota Housing Stability Coalition, and the Minnesota Coalition for the Homeless. I hope it gets your support as well. Big thank you to Representative Zeleznikar for her leadership on this issue. Thanks again to Christina. Thank you, Mr. Chair, and thank you, committee members, for your public service. Happy Homeless Day on the Hill.
Thank you, Mr. Schmidt. Is there anyone else who wishes to testify on House File 1831? Seeing none, public testimony is closed. Questions for the bill author, Representative Curran.
Thank you, Chair. Thank you, Representative Zeleznikar. And for, I know you get this and your testifiers get it, but for anyone else in the room or listening, man, background studies. So necessary, right? We all agree. It's sort of like, it's, if you work in the industry, I don't want to say necessary evil, because it's not evil. We absolutely need it. But I've been on the end of collecting the information for running background studies, doing the actual running of the background study. I've operated the fingerprint machines. I worked for a nonprofit where we opened up as a public location just so that our applicants and employees had direct access to that, but then that opened us up to the public. And so the reimbursement rates for that don't allow for a full-time staff to manage that at any provider. Let me tell you, the $3 or whatever that you get back from it. And so again, background studies, man. So I just want to say I really support efforts where we're trying to reduce the duplication. It is a burdensome process, but a very, very necessary one. So we can't skip any of these. We can't skip any of these steps, but anything that we can do to improve it. And I also happen to work in the Human Resources Department for 5 years before I came to the legislature. And so then I was in the process of trying to hire people, and somebody would have a background study that had just cleared 2 weeks before for a different job that they applied for, and I'd say, I'm sorry, you got to do this one. We'll pay for it for you, and then the cycle continues, right? It really is. It's it's a pain in the neck. And so any way that we can sort of resolve these issues for providers and for people looking for jobs, because it's just, you go from one to the next and hope that maybe you can get in the door sooner because of this process. So thank you for that.
Thank you, Representative Curran. Representative Gander.
Thank you, Mr. Chair. Would you please convince me that these alternative background checks are some way standardized and not just a mishmash?
Representative Zeleznikar.
Thank you, Chair, and thank you, Representative. They are standardized. I mean, the BCA has been doing this for a long time, and I've been around background studies for my entire career. And to Representative's point on this side of the aisle too, she's accurate. It's accurate statement to say that we have issues with criminal background studies, and the goal is to make it efficient and less burdensome. We have a workforce issue. We have a homelessness issue. We have lots of issues. We have care need issues, and to delay it by fingerprinting is absolutely insane. It's a definition of insanity. And as members, this is something that we can support and get behind because there are solutions. And this is a viable solution, a vetted solution, and will allow positive outcomes to happen timely, which is really what it's all about. We have people to serve that need employees to serve them, and it's in multiple buckets. You know, right now, Greater Minnesota has 1/3 of the homeless population, 2/3 here. We have people waiting to be served, and we are delaying it. And we've invested a lot of money in really great programming, but it requires the people that need the criminal background check to be there to do it. And so, members, you have a chance to make a difference, to streamline a great process, and I have no doubt that it will work successfully.
Representative Gander.
Thank you, Mr. Chair. So you're saying that the new way would be as thorough, just more efficient and more cost-effective?
Representative Zeleznikar.
Chair Schumacher, 100%.
Thank you, Mr. Chair.
Any other questions for the bill author? Representative Noor.
Thank you, Mr. Chair. Thank you, Representative Zeleznikar. You said new way of doing the background studies. Do we have that process in a legislative, process? I don't see it in the bill.
Representative Zeleznikar.
Thank you, Chair Schumacher, and thank you, Representative Noor. In fact, I'm meeting with DHS tomorrow, so these steps are all getting all detailed out, to your point.
Representative Noor.
Thank you, Mr. Chair. If I had the authority, I'll delete that chapter 245 and restart it over again because I think there's some challenges. I think the testifier wanted to know.
Mr. Chair, Representative, I just want to point members of the committee to a couple lines within the proposal here, 1.5 and 1.8. To the questions about standardization. So what this proposal would do is make sure that there's alignment with the Kerry-Cassidy Act, which is already a set of background study requirements in place for emergency shelter and supportive housing settings. And then if you head down to 1.8, we're referencing language that Hennepin County already uses for their background check process as well. So there is standardization in this. And I know that Representative Zeleznikar is working hard with DHS on some of the finer details of the language.
Representative Noor.
Thank you, Mr. Chair. Thank you for highlighting the sections 299C.66 and 299C.71. As you've noted that, but some of the background studies requirement of some of the programs that may interact with housing support or supportive housing are required by the federal government. And I don't know if someone from the agency wanted just to put a note on what is a federal government requirement, what is a state-initiated background studies.
Doesn't look like it, Representative Noor.
Well, I think we need to take a deep dive in some of the background studies under Chapter 245. We have got workforce challenges, and there's so many people who've been denied simply because of something that happened prior years when they were just a kid. And they're being denied because of simply having a record, not only in the law enforcement, but they may have a record within the Department of Human Services. And the set-aside process that the commissioner needs to be leveraging isn't done correctly. And so I think we need to have some more conversation on this whole issue of the background studies. And I'm hoping the new contract for the background studies will address some of those challenges. It's coming up, I believe, this year or next year, as we rethink the entity that has got a contract with the state in terms of doing background studies. Some of the individuals who need background studies are traveling a long distance just to get their background study completed. And it's a long waiting time, especially when you're supposed to hit many databases just to make sure that you've got, you've checked every thing that needs to be done. So we need to really have that conversation. We haven't done enough to address the challenges that individuals are facing with background studies. Thank you, Mr. Chair.
Thank you, Representative Noor. Any other questions for Representative Gander?
Thank you, Mr. Chair. The beauty of standardization is it would make the background study portable, right? If you just cleared a background study for this to the standard which we've described, it becomes portable to your next place within a certain time frame, right? Yeah. Thank you.
Yeah. Final word, Representative Zeleznikar.
Thank you, Chair Schumacher, and thank you, members on both sides of the aisle. As you can see, this is where we have a lot of opportunity to do bipartisan work. It is something that has been important to me for many years, caring for seniors. And we have an opportunity to fix this and to make it better. We have to ask, why are we doing what we do? How are we doing what we do? And what is the cost? And is there better ways? And there are other options. And so I will be meeting, and I pledge to you to meet with DHS. I would welcome to have meetings with members on either side of the aisle. I understand the implications of the cost of driving 40 miles. In Duluth, there was a time there was no place open to get fingerprinting for a significant amount of time. And so imagine that. There's just not anything in a town that size, community that size. And so we have to have systems in place, whether it's dealing with homeless and work through the state and federal issues. I'm willing to do that. I will be working with DHS to make sure that in this scope of serving the homeless, that we can start with this. But my challenge to members is that we don't just end with this. We have to fix it for the homeless shelters, and then we also have to be looking at a broader-based issues to what the other representatives have said today to really, truly solve this for the workforce, because we have an opportunity to make it better for Minnesota. Thank you, members.
Thank you, Representative Zeleznikar. And House File 1831 as amended is laid over. That concludes our agenda for today. We get to meet again tomorrow morning, 8:15, Thursday, March 13th. We are adjourned.